Hi, my name is Dr. Geoffrey Fortner, and I'm a psychiatrist and addiction medicine physician. I'm also the physician executive for behavioral health for Community Health Network. I'm here today to let you know that May is Mental Health Awareness Month. I also want to talk to you a little bit about depression and suicide risk factors, as well as the importance of treatment for these medical conditions. Mental Health Awareness Month was actually first established in 1949. The importance of this, however, has never been greater than it is today. In the United States, 1 in 5 individuals live with a serious mental health diagnosis. That equated to almost 58 million people in 2021. The tragedy of this is that only half of those individuals actually receive the treatment and care they need. There are a number of reasons for this, and one of the most frustrating is the stigma that still surrounds mental health and addiction diagnoses. There were many challenges that came to all of us with the COVID-19 pandemic. Challenges with our mental health well-being in the United States was one of the most significant. In 2018, prior to the pandemic, 18.5% of the population reported elevated depressive symptoms within the past 2 weeks. By December of 2020, that number had risen to almost 33% and has only receded back to 22.5% as of 2023. Mental health and addiction illnesses can make people feel isolated, but as these numbers clearly show, there are millions of people that live in our communities that too often suffer in silence without receiving the valuable treatment they need. Now I'd like to talk with you for a minute about recognizing symptoms of major depression in friends and family, or maybe even yourself. Symptoms of major depressive disorder include feelings of sadness and hopelessness, a loss of interest or pleasure in activities, a change in appetite. Sometimes this can be an increased appetite or perhaps the lack of an appetite. Similarly, found with changes in sleep, perhaps you find yourself sleeping much more than you used to, or otherwise maybe you're tossing and turning at night and not able to get to sleep. Depression can be characterized by a lack of energy, trouble concentrating, restlessness, feelings of worthlessness and excessive guilt, and at times most concerning thoughts of wanting to die. Generally, for a diagnosis of major depressive disorder, we expect the symptoms to be present for at least 2 weeks and to cause significant distress in social or occupational functioning. However, even if the symptoms do not rise to the level of a major depressive diagnosis, it is still important if you're having any of these symptoms to share this with a medical or mental health professional. Sometimes these symptoms can represent depression, but other times they're symptoms of another medical illness. One of the most important aspects of Mental Health Awareness Month is suicide awareness. In 2022, the suicide rate reached its highest point since 1941. There were over 49,000 deaths from suicide in 2022. This equates to 1 death every 11 minutes. Suicide continues to be one of the top 9 leading causes of death for individuals aged 10 to 64. Even more concerning is that suicide is the second leading cause of death for those ages 10 to 14 and 20 to 34. There are also as many as 10 million individuals who have had suicidal thoughts in the past year. 3.5 million of these individuals made a plan, and 1.7 million attempted suicide. Death by suicide is an epidemic, but it is preventable. The way to prevent suicide is to know the risk factors and resources available. Risk factors for suicide include a previous attempt, misuse of alcohol and drugs, a depressive or mood disorder, access to lethal means such as firearms, knowing someone who has died by suicide, social isolation, a chronic disease or disability, and lack of access to behavioral health care. One concerning statistic around suicide is that about half of all the individuals that die by suicide have been seen by a medical professional within the last 30 days. Many of these individuals do not want to die, they want to feel better, and they want to find treatment for the unpleasant symptoms they're struggling with. Now it's time for some good news. Depression and suicide are treatable. When a person goes to seek help from a psychiatric professional, there are a number of options that will be discussed. Medication is certainly an important component of depression treatment, but it is by no means the only option. For years, research has supported that medication and therapy for the treatment of depression work better together than either one independently. Along with medication and therapy, there are a number of things that a person can do to enhance their recovery. People with depression will often get better faster if they are taking their medication consistently, attending all their scheduled appointments, researching and learning about their condition, and letting their treatment team know of any changes in their symptoms. Finally, there are a number of other components to a treatment plan that can make a huge difference. Things like eating a healthy diet, maintaining a regular sleep schedule, including family and social supports in your recovery, working with your doctor to learn about strategies for tobacco cessation, staying busy and minimizing downtime, embracing spirituality in whatever way it's important to you, and engaging in regular exercise. There was a recent study published that suggests for some individuals, regular exercise was as effective as medication and therapy for the treatment of depression. Thank you for taking the time to celebrate Mental Health Awareness Month with me today. If you or someone you know is struggling with mental health issues, please know that there are resources available. For thoughts of suicide or self-harm, there is the 988 Suicide Crisis Lifeline. This is a national number, much like the 911 system, that can be accessed 24/7 and provides a free and confidential resource for those who are struggling. We also have the Community Fairbanks Behavioral Health Crisis Department line. By calling 317-621-5700, an individual has the opportunity to speak to a crisis therapist immediately or schedule an evaluation in the coming days. Remember, mental illness is treatable. Being aware and utilizing the resources, we can make a difference in the mental health wellness of our communities. Thank you.